Hello. Recently, colleagues asked me how I solve burnout with communication. And from the tone of their voice, they thought I was in over my head. And I thought, wow, this is a great opportunity for me to share. I came into the field of burnout through bullying. I've been the victim and I've been the bystander way too many times. I've seen bullying. I've been a locum for roughly 10 years, maybe a little over. And I've seen bullying across many geographic areas and in all different economic and racial environments. And it's always ugly. And when I've called it out, someone inevitably says, that's not bullying. That's just the politics of medicine. Wait, what? Of course it's bullying. That's just not logical. When someone is treated like less because of their race, gender, religion, or country of origin, that's bullying. And when that same person is given a greater workload or lower paying patients or denied certain bonuses, that's bullying. Now, in the spring of 2021, the AMA published a series of articles and finally stated that bullying in medicine does exist. And they came out with a plan to combat it. And these articles were based on a study that they had been doing since the early 1990s. In other words, they had been studying this for nearly my entire career and not saying anything about it. Think about that for a minute. An entire generation of physicians endured bullying while the AMA studied it and said nothing. Bullying is causing people to leave the fields of medicine and nursing. It is a driver of burnout, and I know firsthand that bullying is a driver of suicide. I've watched it happen. I could stop right here, but I won't. That's not what I'm here to discuss. I'm here to discuss the relationship between burnout and communication. When the AMA revealed their findings, they made some recommendations. They recommended programs for both bullying and burnout, but not communication. When you were a child, when you or a friend got in a fight with a bully, they recommended two things were recommended by your teachers and your parents. They recommended first that you apologized to the bully, whether it was your fault or not. And they recommended that you and the school bully sit down and talk out your differences. They asked you to communicate. So the AMA gave vague recommendations about changing your policy, something to the effect of making people feel safe about reporting bullying, but nothing where the victim and the bully sit down together, supposedly to protect the victim. But basically all that does is perpetuate the problem. They said nothing concrete about culture change because that's hard and no two organizations are going to do it the same way. And what came out of all of this was a rash of new trainings on resilience and mindfulness. Studies have since shown that healthcare workers are some of the most resilient people on the planet. We go into our professions knowing that we're going to be dealing with death on a regular basis, sometimes even the death of our colleagues and our own family members. And as for mindfulness, well, I like mindfulness. I do roughly an hour of mindfulness every morning. But mindfulness will only affect about 20% of the drivers of burnout. The other 80% are organizational. And without organizational change, you're not going to make a big impact on burnout. Let me say that again. 80% of the drivers of burnout are organizational and will require organizational change. You can't make it go away with meditation and yoga, no matter how much you may want that. Secondly, mindfulness doesn't work if it's forced upon you. Even if you are interested in mindfulness, if you're not seeking it, and there's a difference between interested and seeking, if you're not seeking it, you aren't going to get the expected gains. That's just the way it works. So if you're not seeking it out, you aren't going to get the expected results. There are some people who say that if it's forced upon you, it may actually do more harm than good. And we're now starting to see that in some of the workplace mindfulness programs. Therefore, you must have culture change. Now, I bring a system of communication that brings about culture change. And that's how I'm battling burnout through communication. Perhaps you've heard the phrase, culture eats strategy for breakfast. Now, when I said that, another friend piped up, yeah, but you rise to the level of your goals and you fall to the level of your systems. Yes, I get that. Your strategy is your system. And as I've said twice now, I have a system of communication that brings about culture change. If you follow the system, it becomes sustained culture change. How does it work? We teach people to speak to one another's values. Have you heard of listening to answer versus listening to understand? Well, we take that one step further. We teach people to listen for one another's values. People's value code, what we call their bank code. So we start by having everyone learn one another's values. And then we teach you to speak to the other person's values and listen for those values. What we call their value code, what we actually call their bank code. But you learn each other's values, their value code. And when you do this, two things happen. First of all, it makes the other person feel valued. And secondly, you actually start to value them more as a person, as a human being. And then you start to value what they're talking about and what they care about. And this is huge. We actually spend a lot of time on this, on just this concept. This alone can turn a dysfunctional physician into a leader. And then once you've mastered this, we introduce you to some expert boundary setting and negotiation skills. Now, in healthcare, administrators appear to have all the negotiating power. They seem to hold all the cards, so to speak. However, they have no organization without physicians to manage patients and write orders, nurses and RTs to do the bedside care, lab techs, phlebotomists, x-ray techs, housekeepers, unit clerks, security guards, and so many others to make the hospital whole. That without all of us, they're nothing. And administrators are more aware of that now than ever before. So if you have the administrator's value code, their bank code, and if you have their value words and the negotiating skills, then you can set boundaries and level the playing field. So here's my advice. Know what you want. Know what you want and ask for it while speaking in a way that values everyone at the table. This is how you get sustainable culture change through communication. This is how you fight burnout through communication. Communication is everything. I'm Dr. Nan Nussel of Beat Down Burnout. And if you want to hear more about this, or if you'd like to have me come speak to your organization, then contact me at drnan@beatdownburnout.com. That's DRNAN at beatdownburnout.com. Thank you so much.